So Sheridan, part of what you're talking about is giving nurses and those in the clinical setting adequate training to really be able to appropriately treat those who experience sexual assault and to sort of have the education to do that. It's my understanding that there's some misperception about these exams to begin with, both in part by law enforcement, maybe even those who experience these assaults, and that can be a problem, obviously, in making sure that people get the care they need.
Absolutely. If these exams are done by somebody who's really competent, is very well trained and well supported, this really can be the first step in somebody's healing. So the exams are not uncomfortable, they're not painful, the patient maintains control over everything that happens along the way. Sane trained nurses are very good about giving patients options and explaining things as they go. So it really can be a very positive experience, and I think the public doesn't have enough of a perception about how useful just coming and being able to ask questions of somebody who has seen lots of this and can explain. So for instance, if I saw somebody who has an injury, that I can say, I do see an injury, but by the time you come back to see me, your body will have completely taken care of it. We can also answer questions about any misperceptions that people may have about what this might do to their reproductive system or other things that maybe somebody has threatened them with. So it's an opportunity to do that, as well as to link someone to advocacy services and services in the community that are really an important piece of their journey. So I think it's really important that we have people that are very confident, have seen a fair number of these exams, and have watched somebody who is really comfortable examining patients that have experienced trauma, to know how to ideally respond to them. And then it can be a very good experience.
So I'm always amazed in the healthcare setting, in the general setting, by people who do this work, whether it's trauma, whether it's emergency department work, working with, people with special needs. This has to be very emotionally challenging and very stressful work. So how do you keep people involved, not burn them out, after the training, actually retain them in their expertise?
That's a great question. And I get that question a lot as I explain what it is that I do. But I think first is that it's really fulfilling work, especially if you have colleagues that you can share some of that burden. It is emotionally difficult, but it's also really rewarding. And if we can support people and allow them to kind of grow in their expertise and share their experience, we can do that in a number of ways. And I think we can solve that, again, using telehealth. So we can offer the 24/7 live support, so you have a colleague that you're working with to do this. The gold standard in this work is peer review. So it's important, I think, to create a network of colleagues that can share their experience. So if you're a lone examiner working in a community, really important to be paired with other nurses who are doing this work so that you can share the concerns you have and the challenges you're experiencing in the field, because someone else might have a good solution or something they've tried that really worked. The other thing that we can do then is to bring all of the nurses that are at our pilot sites with our expert nurses together to share cases, talk about those challenges, talk about new evidence as it comes out and how we build in and enhance our evidence-based practice. All of those things reinforce that what they're doing in their community is really valuable and important. And I do hope that it will ultimately sustain people in doing the work.